most famous physical therapist on the internet.
Hi there, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
This is kind of a nondescript title. Pain here, question mark, how to fix in 3 steps. So we're talking about pain in your butt.
The old buttocks.
If you look at the thumbnail, it actually an arrow pointing to the pain right in the butt. And this used to be called piriformis syndrome because there's a little muscle in your butt called the piriformis. We're going to get into this during the show.
Okay.
Right now, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. This week, we're giving away the doozy. We're giving away the free mattress. It's a free mattress.
You win it. They're going to send it to your house. 700 tiny mattresses in one.
This is a sample of the Sleepovation mattress, and it's got air channels. It's very comfortable if you have a pain issue.
Even if you don't.
Even if you don't, yeah. So you can also find the contest. It'll be pinned to the top of the page at Facebook, and if you go to Twitter, Instagram, or TikTok, you get a 60-second version of Bob and Brad instead of these long, drawn-out ones.
Yeah, no, not as much babble there.
Yeah. And finally, we have the podcast, too, now.
Oh, yeah.
You all have been waiting.
Yeah, we've got some wonderful people we interview.
So, again, it used to be called piriformis syndrome. It's a little muscle. It crosses over the sciatic nerve. So, the sciatic nerve goes all the way down your leg, and it can that muscle can cross over the nerve and actually cause pain all the way down your leg.
It's not
a lot of people think it's sciatica because it acts like sciatica, but you don't feel any back pain along with it.
Right. So they could sometimes called fake sciatica.
Right. Exactly. Now, as progress would have it, over time now they think that maybe more than one muscle is involved.
Right. I wonder who they is.
Yeah, I don't know.
That they.
But there's other muscles, the gemelli, obturator internus, your hamstrings.
These are all little supportive muscles around your hip joint that are really critical for supporting, but they can cause problems like this.
So now they call it deep gluteal syndrome.
Ooh,
so,
good choice.
All right. So a simple test. I'm going to show you a simple test, Brad, on how to determine whether or not you have it.
All right.
One anyway. So you're going to lie on your side. Let's say I'm at the pain on this side.
Sure.
So I'm going to do a clamshell.
So you're side lying.
Yep, I'm side lying. The pain, you feel it right here. I lift up the leg, and you're going to have a friend help you, Brad, because you're going to push on that.
I don't have any friends.
Yeah.
Well,
I'll
get my wife. Yeah,
there you go.
She'll help.
Maybe your dog.
So I'm going to push here and hold resistance?
Yep, exactly.
Yep.
Go ahead, push.
I'm pushing.
And if that increases the pain, or maybe even sends symptoms down your leg, it's a possibility.
Right. It doesn't mean you definitely have it.
Right.
But so this is one, you say yes, positive.
Yep. And you can actually push on the hip and find a spot that's really tender.
Yep.
Very common. I always do this one too, Brad, where I just have people lie down on their back and pull the leg across.
Yep. So that knee to the opposite shoulder.
Right. And it always feels tighter, it seems like, on that side.
So you compare one to the other, and it's a noticeable difference.
Yep.
I've done that with many patients.
Yep.
myself.
It seems like it's pretty consistent on that. So the other thing is you might have a hard time sitting because, you're sitting on that muscle. And in fact, the last person I saw that had this, she was an accountant.
Oh.
And she sat all the time, of course, and the pain was, of course, worse with sitting.
Sure.
So the first thing you're going to want to do is actually you're going to want to decrease the pressure on the area. So when you're sleeping, I would sleep on the other hip.
Okay.
To take the pressure off it. When you're sitting.
How about sleeping on your back?
You can sleep on your back, although you're kind of hidden, fairly close.
You'll know if you're laying there and it's irritating it, and you want to sleep so it's not irritating it. You may need to put some pillows.
Karen's going to be mad at you.
Did I say
laying there? Oh, you're lying.
I got a check mark on my
that's right.
card.
So it was sitting. You can, a lot of times, if you sacral sit, do you know what that is, Brad, of course?
On your sacrum.
Yeah.
So you're slouching.
Yeah, you're slouching. But if you sit up straighter, you can maybe keep the pressure off that area.
Once again, posture, posture,
Yep.
posture.
So, and then of course, standing. Don't put all the weight on one side. Don't. Yeah. Exactly.
No.
So we have found massage to be I have anyway, to be the most effective treatment
Yeah.
for this, Brad.
You can combine it, I think, with the stretching.
Yeah, with the stretching. We'll
That-
show you stretches. But and I have found generally you can't do it with your hand. It just fatigues.
Well, it's a large. You got to get in deep because you're going through your gluteus maximus and your hands fatigue pretty rapidly.
Yeah, and generally
And
what
it's-
we do is we start with a wide target around the whole sore area, and then we eventually narrow into the tender spot
Sure.
as you could tolerate it.
Mhm.
Now, we've got a bunch of massage guns here that work really well. This is actually a little tiny one that we have that it's very powerful.
Mhm.
This past weekend, I had a bunch of friends at our cabin, and these are big guys, some of them,
Oh,
and they all love this. They're
Oh,
all passing
really?
around.
but
So
you had this one too.
no, I didn't have that one. I only had this one.
Oh,
It was
no
only-
wonder they love.
The only reason they loved it. So,
I have a patient with a hip problem right now, and he prefers that over this because it's easier
the leverage.
to grab onto and that kind of a thing. Especially if you happen to have a hand problem,
hands.
arthritis in your hands of something of that nature.
Yeah, if you get a bigger one, this isn't that big either.
No,
We
they
have
come up with the big Bertha, you know.
We have the big birthday.
Yeah,
Here
there
it is.
Oh, yeah, that one.
This baby.
Yeah, you
That's-
know, if you're a younger person and you're pretty built and whatnot,
Yeah.
you definitely want to
Yeah,
get the
if you're-
bigger one.
If you got a lot of muscles, you want to
Mm.
use that one. So now you can lie down and put a pillow between your legs and make yourself comfortable and just work that area.
Yeah,
You'll be able to find this
you're
one.
going to do what's most comfortable. I've done it, this way where if you flex the hip a little bit, it kind of allows you to get into that area better and work it here. So this leg is completely relaxed right now, and you can work it and you get up. I really enjoy getting around that SI joint area. It's always been a problem of mine, and that's very close. So you're going to work what feels good on that piriformis or the part we're talking about. Like Bob said, you get right over that sore spot. It might make you jump.
Right.
Go around it and work your way into it. It may take a few days before that happens.
Exactly. But again, I don't know. Sometimes I wonder, Brad, if that muscle has been torn a little bit and maybe there's some scar tissue around
It's
there.
possible, yeah.
It seemed like that was the case with some of my patients. And then you're going to stretch the muscle too.
Yep.
So I want you to, one way you can tell, Brad, whether or not it's tight or not, is you externally rotate your legs.
So toes
And
go
if
out.
one turns out more than the other, like you just sit there and go like that. Now look at mine.
Well, your left toe is going out this
Yeah.
way, and this one not so much.
Yeah. So I am a little tight into external rotation. My external rotator is pulling me out a little bit.
Well, yeah, either that or you got tibial torsion.
That's true.
So what I meant, you can't always say that's
No, you
it,
can't.
but
You
you got to
can't.
look at it and combine these tests.
Right. So what you do to stretch it, there's a couple ways. So for you therapists out there, beyond 60 degrees of flexion, the piriformis is actually an internal rotator. So to stretch it, we're going to put it into external rotation.
Sure.
So you do a figure 4 stretch. You bring this leg up. I'm stretching this one on the left. I'm going to cross my ankle over my knee. I'm just going to press down like this.
This should not create any sharp pain. It should just be a stretch. Feel like the muscles are stretching the hip joint.
Now, the muscle is also an adductor. So I'm going to stretch this way too.
Okay.
I'm just going to pull
So-
over like that.
Lying on your back or seated up.
Yep. Oh, I'm sorry. Abductor. So
Abductor.
it's like this, Brad.
Yeah,
I'm
that's. I
actually-
was kind of
oh,
wondering
yeah,
about.
you were wondering
that.
about that.
But I thought, well, he'll correct.
Yeah, I'll
himself.
correct myself. So
Good
I'm
test.
stretching this one again.
Yep.
And stretching it by pulling over.
You could. Sometimes I'd pull with the other arm.
Oh, yeah.
Yep.
Like that.
Yeah, you could do the pretzel
With
stretch
both, yeah,
too.
with both.
Yeah.
Keep good posture.
Sure. Yep.
So
There's a lot of different little things you can figure out as you do it. You'll know because it'll be stretching it. What about the seated one? Does this count?
yeah, because you're in
Whoa.
greater than 60 degrees of
Yeah.
flexion.
And
So
sometimes we can do a little bit of
yeah,
that. Try
that's
to keep
probably
your
the
back
easiest
straight.
one to do is just to go ahead and do it that way.
When you put your shoes and socks on, give them a
Yeah,
little stretch.
give her a stretch. All right, massage, stretch, and hopefully it'll go away on you.
Oh yeah.
Yeah.
I've had fairly good luck with this. in
I have had
general.
too, and it's always been massage that's been helping these people.
Sure.
In my mind.
Mhm.
So remember, Brad and I can fix just about anything.
Except for
A broken heart.
yes, but we're working on that, and I don't know.
Massage maybe will help that too.
They could make a gun for that. That would be good.
Yeah. A love gun. According to
Wow.
yeah, that's good.